Okay, so welcome everyone. I'm very excited today to be interviewing Jennifer McGeorge, who is the owner of Oasis Menopause Care. Jennifer and I are going to be collaborating to provide you with all of your hormonal needs, and we are very excited to be working together. And I wanted to give you an opportunity to meet Jennifer and hear about her past work experience and what she's doing currently with her practice. And yeah, let's just get started. So, Jennifer, why don't you tell us a little bit about your background as a nurse practitioner and your kind of your career path up until now?
Sure. Well, Abigail, first I want to say thank you so much for having me speak to your population and your people and introduce myself. It feels like a great opportunity, and coming to Ridgeway and working with you feels like a really great opportunity as well. I feel like I have a lot to offer. My career in women's health began a long time ago. I was considering taking the MCATs and becoming a doctor, and then I started talking to an old family friend who was a home birth midwife, and I apprenticed with her and went into practice with her. And the more I learned and did, the more I wanted to learn and do. So I ended up going to nursing school with the goal to be a nurse midwife and took a little turn and was a labor and delivery nurse for many, many years. And that was a very, very rewarding work to be able to do. Home birth was wonderful, and I loved the one-on-one care, the very personalized care, the care that could have more time to spend and time to talk about the lifestyle, things that are so important for our health, whether it's pregnancy or menopause or any stage in between. Being able to focus on nutrition and people getting out and exercising and having good relationships, all of that is still such a huge part of my practice and how I approach health and wellness. But if 99% of people were not giving birth at home, I wanted to learn more and gain more experience and be able to meet them right where they're at. So I worked in the hospital for many years and got to meet people and have experiences I never would have had otherwise. And then I finally did pursue my master's degree in nursing and became a nurse practitioner, specializing in nurse midwifery, and worked full scope hospital practice for about 8 or 9 years. And that too was very, very rewarding. And I ended up stepping away from that during the pandemic. And then I did a research job with a doctor about the Amish population. And then I started doing clinic work. And about 2+ years ago, I moved to Montrose and decided I didn't want to go back to the hospital and pursued my certificate to be a menopause care provider. I've always been very interested in menopause and being menopausal myself. I really felt like I wanted to take a real deep dive, and it's just been very gratifying to just expand my knowledge base, expand my experience base. I definitely have worked with perimenopausal and menopausal women throughout my career, but that was somewhat limited because my focus was so much more on pregnancy. But certainly the perimenopausal women, helping them out when they're juggling the hormonal fluctuations of perimenopause and a newborn and a family and a job, it's a lot. And so helping them to find balance has always been something that's been really gratifying. Um, I never thought I would own my own business, but it just felt like there were many things that were pointing me in the direction that actually hanging out my own shingle and starting Oasis was going to be a continuation of taking barriers away, being able to meet women right where they're at and give care that is personalized at this time that is really, really key. So earlier this year, I started my business, and I have a beautiful office space in Montrose that I love. It's in a historic building downtown. And I also offer telehealth services to anyone in Colorado, Wisconsin, or New Mexico. My client base has been slowly but steadily growing, and I've definitely gotten great feedback from people about the services that I provide. I provide both hormone therapies, other prescription therapies, non-prescription therapies, look at the lifestyle modifications, Sexual health and wellness is a really important part of perimenopause and menopause, and I'm super passionate about that. And now you and I are partnering together, and I'm going to be able to meet your wonderful patient population and serve the people of Ridgeway and our surrounding areas. So I'm really excited to be here.
Excellent. Thank you so much. Well,
Yeah.
you answered all of my questions that I was going to ask you already. Yeah, I wanted to have you share a bit more about how you work with patients in this new model of your practice. And you kind of touched on some of those things already, but maybe tell us a little bit more about, well, like maybe just take a typical patient in mind and think about what kinds of recommendations or modalities you might suggest and how you work with that person and what your follow-up is like with the patient and that type of thing.
Sure. Well, I don't at this time accept insurance. I can take FSA funding, but it's mainly private pay. But in doing that, I've found that it's a very successful model to usually have a meet and greet phone call with a patient before she actually comes in and is paying for service. So that way I can find out where she's at, what she's looking for, and we can make sure that we're a good fit. And it's a nice way to get to know each other. Once we agree that we're going to schedule an appointment, then I welcome people to my electronic health record and into my patient portal and my system. I have people fill out their consent forms, and then the intake forms are actually really important too, because I want to get a sense of where a woman is at in her menopause or perimenopause journey, in her transition, and also what is she experiencing with their symptoms, but what is she looking for? Right? I mean, I've had a few women and they're, well, I want to be doing things with menopause, but I really want to be doing, I want to be doing the weight loss drugs, right? Ozempic type thing. Well, that's not something that I do. And so, sure, I could help her with all of her menopause needs, but I would then hope want to be able to refer her to be able to get all of the care that she needs. And I really think that in today's times, you can't just have one doctor typically. And I think, especially in menopause and perimenopause, having a team of people that are going to help us with our individual needs for our wellness. So I have a very, very robust referral base. You're in my referral base, right? If someone needs a naturopathic doctor, wants to be working on their gut health and things like that, I have people to refer to. I also have massage therapists, PT, pelvic floor PT can be very significant and very helpful in menopause. So I really want to be able to help women get to other care practitioners to kind of fill out that whole picture. But for my own self, I definitely looking at all the different symptoms of menopause that women can present with. And a key piece to figuring out where we want to go with the treatment is very oftentimes education, right? Very many healthcare practitioners don't know very much about menopause, and it's kind of amazing how many women don't really know what's happening to them in perimenopause, in menopause, and then after. So, being able to dispel myths and give women education about what is happening, what has been happening. And I also find it super important to be able to give anticipatory guidance and start to give women a sense of where they might be heading so that they can be proactive and maximize on their health outcomes, but also to give reasonable expectations, right? Because even in perimenopause and menopause, if we are super on our path to wellness, we're not ever going to be 25 again. We can feel healthier than we've ever felt in our life, but we are not going to be 25 with that same dewy, fresh resilience. So I really want to be realistic about that and help women to be the best that they can be right where they're at and hopefully cultivate seeds of self-acceptance and self-love. We struggle so much with accepting our bodies, loving our bodies. And if we're not going to do it now, when are we ever going to do it? So I really, really encourage women to think about being strong and healthy instead of skinny and fitting some sort of a beauty norm that's kind of unrealistic. We spend so much time of our life doing that that maybe now is finally a time when we can really switch gears. And I really try and give women the support that they need to be able to do that. One of the things that's very significant in the care I provide is I provide trauma-informed care. As a nurse, I provided trauma-informed care as a nurse midwife. And now in this time of menopause, I find that it's incredibly key. We can pretty much expect that women who've had trauma, even if they've dealt with it very well with the help of therapy, other wellness modalities, it's usually going to raise its head again in the menopause time. And it doesn't mean that we haven't dealt with it. It doesn't mean that we're losing it. It means that it's time for us to take stock as we move forward into this really potentially very rich phase of our lives. So I want to be very ready to meet women in that and help them have a safe space and support themselves as they move through whatever emotions, moods that they might need to as they're going through this transition and hopefully get the support that they need. Um, as
I
I
love
mentioned,
that. So this is highlighting one of the differences between the experience of seeing you, a nurse practitioner, versus a another type of provider, is that you have some of this background and knowledge and desire to bring some of these other aspects, especially mental health, into your practice, and being aware of that with every single patient is
mhm.
one of the things that I love about nurse practitioners and really sets you apart. And so in your practice, you are able to prescribe hormone replacement therapy.
Mhm.
And then what other types of modalities or treatments do you often use for women in caring for them in perimenopause and menopause?
Well, there are many different types of hormone replacement therapy, different routes that we can use, oral pills, there are topicals that we can use. And a lot of people aren't very educated about the vaginal estrogen that we can use for the what's called genitourinary syndrome of menopause, which is the vaginal dryness, sexual discomfort, and then some women also have the urinary symptoms with that. And that vaginal estrogen is A, very, very effective, B, very, very inexpensive. And it's something that a lot of women can really benefit from, and a lot of people don't know that. And it's very, very safe. So even women who have contraindications to other types of hormones are able to use that vaginal estrogen. And I just really want to spread the word about that because, again, a lot of women don't even know what to call what they're suffering from, much less ask for some relief. There are many other prescription modalities that I'll use. Some women who can't use estrogen or don't want to use estrogen, lower dose antidepressants can be very effective. Besides estrogen and progesterone, there's also DHEA, other hormonal type medications, testosterone. And then there's also herbal modalities that we can use, right? Non-prescription. Homeopathics are a friend that I've certainly used a lot in my professional life, and I think that they can be very, very effective, and I love them because they don't have a lot of bad side effects. So that's a real plus. And the lifestyle changes that people can make and be supported to make can make a lot of difference in what they're feeling with their menopause symptoms. One of the biggest things is helping women get sleep, right? Because if they're not getting the sleep, then the mood is not good and the memory is not good and the relationships aren't that good. And it just makes everything so hard. So, if that's a key piece that we're dealing with, there's so many things that we can do herbal, homeopathic, but then also doing mindfulness, creating a really dedicated sleep routine that is about self-care and self-love that allows us to kind of get into that more parasympathetic rest and digest, really start to learn how to give our bodies that rest because that's when we repair. That's when we become more resilient. That's when our brains are able to just completely cleanse themselves on a nightly basis so that we can deal with the adversity that we need to deal with in a day, but so that we also can be our healthiest selves and have immune systems that are working well and hormonal systems that are in harmony instead of in kind of a chaotic place.
Great. Yeah, I love it. I love all those different options that you can offer. in meeting women where they are. And for some, the hormones will be appropriate, and for others, yeah, you'll be thinking about other things. So
Well, and
that's
with that education piece too, sometimes it's really laying out the different options that are there for women, and then they might not make a decision while we're at my office. I don't want them to feel like they're rushed at all. I want them to feel like they can mull it over. They can send me a couple questions if they need to, and if they want to let me know in 3 weeks, okay, now I would like to try some estrogen, or now I would like to try the herbs that we were talking about, and I'm calling an acupuncturist, and I'm trying these other things that we discussed. Because we're not in a hurry, and I want people to feel like they have the time. And I love it that I now have the time that I can spend with my patients, and I'm not pushed by being in a healthcare system, having to see 3 patients an hour and just run everyone through. I have the time
yes,
to
I
really
bet
be.
that's so refreshing for
It
you.
is. I love it.
Yeah, that's
Yeah.
great. I love that about my practice too, where I can really
Yeah.
take the time that's needed for the patients.
Hmm.
Good. Well, I feel like we learned a lot about your practice and what you're up to now. And so Jennifer and I will be collaborating together to meet all of your needs in perimenopause and menopause. And we will be putting out more information very soon about how you can take advantage of that. One of the things we're going to do to get started with is to have a day or two in my office where we're seeing patients together. So you get the dynamic duo of the two of us together, working on your toughest hormonal difficulties, and just so that you can get a chance to meet Jennifer. And if you've never seen me before, you can meet me as well and see how we might work together. But I'm really excited to get started working with Jennifer. She's fabulous. I've had a wonderful time these last few months getting to know her, and yeah, I think it's going to be a great way to team up and offer both of our skills for you to have basically just the greatest amount of support for you in your perimenopausal and menopausal journey. So very excited about what is coming for all of us. So thank you so much, Jennifer, for sharing about your past practice and your past medical experiences and your what you're doing currently. And yeah, very excited to continue this journey of working together. All
Yeah,
right.
me too. Thank you so much, Abigail, and thank you, everyone. I look forward to meeting people in Ridgeway. Thank you.
Great. All right. We're gonna say goodbye here.
All right.